40 units of Botox on my 11s and forehead. Still not working after 10 days. Help. I got Botox done for the first time 10 days ago. I'm 28 and don't have any deep lines. I got 25 units for my frown lines and 15 units on my forehead, a total of 40 units. I can still frown easily and still have the 3 small lines on my forehead. Is there a reason why it's not working yet?
Thank you for your question. You submitted your question with some photos, and you describe in your question that you are 28 years old and you got Botox 25 units for your frown lines, 15 units for your forehead, approximately 10 days prior, and you're asking why you can still frown so easily and that there are these certain lines are still present. Certainly it's important that this type of question be, first of all, addressed to the doctor who performed the procedure, but I can just share with you how I discuss Botox, particularly for people who get it for the first time in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In fact, my specialty, oculofacial plastic surgery, were amongst the first physicians to use Botox. And so I have been using Botox for my patients since 1993. And as far as my approach to the protocol of treating my patients with Botox or any injectable, whether it's a neurotoxin or injectable filler, I routinely see my patients in 2 weeks after a procedure, especially if they're new to our practice. It is always a get-to-know-you process when you do something like these types of injectable procedures to see how it works for the individual patient. There is always a range when it comes to the neurotoxin of average doses that are given. And it's also in the context of the relative activity of different muscle groups in a given patient. Now, essentially, it is understandable that if your goal was to have no movement in the frown area, well, if you're still able to move, I could understand why you're concerned. A lot of times you can also follow whether or not your movement, or determine, I should say, what your level of movement is compared to pre-treatment. The ability to move at all is not always a bad thing. If the frown area still moves a little bit compared to it moving a lot before the procedure, well, certainly it's within a normal range, but if it's unchanged at all, then there's essentially 2 questions I think come to mind. One is whether or not the Botox was administered in the right places, in the right way, which is typically likely since this is a very popular area. I mean, the FDA approval of Botox cosmetic is actually for the frown line area. And so it's the number 11 is one of the most popular areas to do. So it would be difficult to imagine that it was technically difficult for an experienced practitioner to deliver. And the next is, of course, dosage. You might need a higher dose. And certainly that is conceivable. There's always people who need more and always people who need less. And there are patients who come in and say to me who have had Botox done before that they're extremely sensitive and that they want me to start with very low doses. And others will say Botox doesn't always work for them and they need high doses. So it really is a matter of getting to know the patient. I think it's reasonable for you to go back to your doctor at about 14 days, as is routine in our practice, and ask this question. And basically what I offer is enhancement. If someone needs enhancement, there's no problem, we do it. It's part of the whole getting to know you process. A lot of times it also gives me an idea of what kind of dose they would need so that the next time we do it for them, we have a total dose that we know based on the previous experience to apply at the first treatment. And I still allow patients to, or recommend patients to come back after 2 weeks for evaluation. So I'd say that it is, if you've made a choice of practitioner for your treatment, that you shouldn't abandon hope so quickly. Just meet with the doctor and ask about enhancement, and then learn from there what the right dosage and areas work best for you so that you get the outcome you want. So I hope that was helpful. I wish you the best of luck. Thank you for your question.